Since the first case of coronavirus was confirmed in our country, since then, all our lives have changed in fundamental ways. As a nation, we've been forced to take aggressive action against an invincible enemy that has threatened our lives and the lives of our loved ones. We have been forced to adapt to a new way of living in a short space of time. As we enter the 5th week of an unprecedented nationwide lockdown, and as we look to the future, we should remember why we are here. The novel coronavirus, which was identified in the Chinese city of Wuhan in December last year, has spread rapidly across the world. To date, over 2.6 million confirmed cases have been reported worldwide. The actual number of people identified is likely to be far higher. The coronavirus cases, the disease known as COVID-19, a respiratory illness for which humans currently have no immunity and for which there is no cure. The coronavirus is passed from person to person in small droplets from the nose and mouth that can be transmitted by direct contact, on surfaces that we touch every day, or when an infected person coughs or sneezes when they are close to another person. Most infected people exhibit only mild symptoms. Some do not show any symptoms at all. Some do not even know they have this disease. But there are people who develop severe symptoms and require hospitalization. These are usually older people and those who suffer from underlying conditions such as heart disease, diabetes, chronic respiratory disease, and cancer. For some of these people, COVID-19 is fatal. They die. Across the world, more than 185,000 people have succumbed to the disease. Here in South Africa, at least 75 people have lost their lives now. Because the coronavirus can spread so rapidly through a population, it can overwhelm even the best resourced health systems within a matter of weeks. This is what has occurred in many countries across the world. And it is precisely this that we, as South Africa, have gone to great lengths to prevent. Very few health systems across the world, if any, are prepared for a sudden and exponential increase in people requiring treatment for a severe respiratory illness. As a result, if the virus spreads too quickly, there are not enough hospital beds, intensive care units, ventilators, personal protection equipment, or medicines for everyone who needs them. To make matters worse, people who are suffering from other conditions or need emergency procedures are unable to get the care that they need. And in such circumstances, many lives that could have been saved are lost. I'm reiterating these basic facts, which by now are known to many of us, because they explain the actions we have taken to date and they inform the measures I am announcing this evening. From the moment we declared the coronavirus pandemic to be a national disaster on Sunday, 15th March, our objective was to delay the spread of the virus. We have sought to avoid a massive surge in infections and an uncontrollable increase in the number of people needing medical care. Our approach has been based on the principles of social distancing, restriction of movement, and stringent basic hygiene practices. By delaying the spread of the virus, we have had time to prepare our health facilities and mobilize some of the essential medical supplies that are needed to meet the unavoidable increase in infections. And it is in doing so that we hope to save tens of thousands of lives. There is clear evidence that the lockdown has been working. Together with other measures we have taken, such as closing our borders and the changes in behavior that each of us has made, the lockdown has actually slowed down the progression of the pandemic in the country. The World Health Organization has commended and praised South Africa for acting swiftly and for following scientific advice to delay the spread of the virus. Yet, while a nationwide lockdown is probably the most effective means to contain the spread of the virus, it cannot be sustained indefinitely. Our people need to eat, they need to earn a living, companies need to be able to produce and to trade, they need to generate revenue and keep their employees in employment. We have accordingly decided that beyond Thursday, the 30th of April, we should begin a gradual and phased recovery of economic activity. We will implement what we call a risk-adjusted strategy